Bore da bawb, hoffwn i ddiolch I Bwyllgor Gweithwyr Proffesiynol Perthynol, I Iechyd a Phwyllgor Gwyddol Gofal Iechyd Cymru am y gwahoddiad I ymuno gyda chi heddiw am eich cynhadledd genedlaethol 2021. Mae'n bleser I siarad gyda chi fel cymuned aml broffesiynol o bob cwr o'r gwasanaeth iechyd a gofal cymdeithasol. Mae'n dda I weld bod pob un wedi ymrwymo I sicrhau ein bod yn darparu gofal o'r ansawdd uchaf posibl i'n poblogaeth. Gofal sydd â'i wreiddiau mewn tystiolaeth ac wedi liwio gan ymchwil yn gysylltiedig â gwasanaethau. Gofal sy'n canolbwyntio ar ganlyniadau yn seiliedig ar ansawdd, diogelwch ac yn sicrhau'r gwerth uchaf posibl. Good morning, everyone. I'd like to thank the Welsh Allied Health Professionals and Healthcare Sciences Committees for the invitation to join you today at your 2021 National Conference. It's a real pleasure to speak to you as a multi-professional community from across the NHS and social care, to people who are committed, I know, to ensuring that we deliver the highest quality of care to our population, care that is embedded in evidence and informed by service-related research, care focused on outcomes, based on quality, safety, and achieving the highest possible value. I'd like to thank each and every one of you for all you've done over the course of the pandemic. You continue to work tirelessly to ensure our services have been able to respond to the many challenges that they've faced. You've also rapidly introduced new ways of working and grasped the opportunity to improve the ways in which you work, with greater use of technology and stronger collaboration. I'm really impressed with the way you've been thinking innovatively to develop short-term projects with the additional Welsh Government funding to tackle waiting lists. But I'm afraid our challenge isn't over, and you've captured that in the conference title, A Healthier Wales Moving Forward Together. We can't afford to lose these benefits as we focus on how to reset our services and ensure the delivery of effective health and care. It's important that we use what we've learned over the past 18 months to support the system to recover from what has been and will continue to be a really challenging time, especially as we face the winter. The current imbalance between demand and capacity requires radical and transformational change. Urgent action is needed to avoid continuing growth in waiting lists and to minimize the clinical risk. We currently have around 625,000 people on waiting lists, including those waiting for diagnostic tests and investigations. We have extraordinarily high demand for access to primary and community services. We have delays in ambulance responses, in accessing urgent care, and in discharging our population back home. Too few people are accessing the community rehabilitation, reablement, and recovery services they need to recover fully and to avoid unnecessary long-term care. Now, every one of you here today is critical to resolving these challenges. I've set out my priorities for health and social care, and I'm clear that these priorities must drive delivery and further improve our services. You will, I know, continue to ensure you deliver the highest value and outcomes, and that patients experience the very best quality of care. Making this change, the vision of a healthier Wales, relies on shifting your skills and resources to primary and community provision, making better use of the diverse assets we have locally to support people and respond to individual needs. We must concentrate our efforts on the whole system, putting citizens at the centre and surrounding them with resilient, local, primary and community care. Rapid access to the right health professional and treatment is critical to achieving this. Timely, preventative interventions must be provided to minimise the impact of delay and disability, and can provide as much self-management and healthy living advice as possible. Accurate, reliable diagnostics, realising the potential of precision and personalised treatments, supported by the work of the national programmes in genomics, imaging, pathology, advanced therapies, and healthcare science, will help drive earlier and more accurate diagnosis. Our system must support people to remain fit, healthy, active, and importantly, out of hospital with the best quality of life possible, with timely access to quality rehabilitation close to home. We will allow people with long-term conditions to live as independently as possible. We need to focus on the whole person, building resilient communities in Wales and focusing on health inequities, prevention, mental health, children and young people, and decarbonisation. Our recovery plan, Health and Social Care in Wales, COVID-19 Looking Forward, builds on the lessons we've learned. It demonstrates our commitment to social partnership, values, and expectation of future integration and integrated approaches, and it sets out our expectations of delivery. Our 3 national programmes, Planned Care, Urgent and Emergency Care, and the Strategic Programme for Primary Care, have been refreshed. I expect each of you, your colleagues and leaders, to be thoroughly embedded in the work to achieve the intentions of these programmes. And we need this to happen in order to deliver the quality of healthcare we want for our family, friends, and communities. It's vital you participate in the delivery of that change, working at the top of your licence and skill set to address service challenges. Your own professional strategic frameworks underpin these national programmes, and I'm really pleased that the implementation of both Looking Forward Together, Allied Health Professional Framework for Wales, and Looking Forward, the Healthcare Science Framework, are firmly in place. I'm encouraged to see that leadership, research, and use of technology are prominent themes of both these 2 frameworks and of this conference. Each and every one of you needs to use these so you can contribute effectively to the health and social care agenda. I'm expecting to see increased use of AHP's expertise in prevention, public health, and primary and community care. I also expect rehabilitation, reablement, and recovery services to be more consistently available and accessible for all. I'm expecting to see role redesign to extend healthcare scientists' scope of practice, including support for new roles, such as consultant clinical scientists. Releasing and harnessing the potential of the healthcare science workforce is of fundamental importance if we are to address service challenges that face NHS Wales in the future. The breadth of new and innovative practice on show here today is so impressive and really reflects the talented and dedicated workforce that you are. I ask each of you listening today to ask yourselves, how can you make this work in your own workplace? It's crucial we harness innovations to our best advantage, using evidence to secure the best outcomes for our citizens. I know you've given everything over the last 1.5 years, but I do need to ask for a little more to ensure that we can continue to provide the quality health and social care that our most vulnerable people require. I also hope many of you will be able to join the Advancing Healthcare Awards Wales ceremony tomorrow to find out the winners of these prestigious awards for AHPs, healthcare scientists, and those working alongside them, and to recognise and celebrate their work. Dwi'n gobeithio Newch chi fwynhau gweddill y dydd. Diolch yn fawr i chi. I hope you enjoy the rest of the day. Thanks very much to you all.